It breaks my heart so much when women end up with chronic kidney failure, or when women die just because they got pregnant, just because they are discharging their God-given assignments. I mean, why would a woman die or end up with kidney failure? Especially this video, I'm concentrating on why women develop chronic kidney failure during pregnancy or after they just gave birth. Okay, my name is Nurse I'm a renal nurse. So this is what I'm going to be talking about. This is disheartening. So I'm making this video to make women more aware of things that can make them get kidney failure, get acute kidney injury, which can lead them to kidney failure in pregnancy or after birth or during delivery. Okay, so please pay attention. You can watch on my YouTube page if at any point in time the video stops. Okay, so I'm going to talk about how to prevent this thing. Please listen attentively. If you have any question, please make sure you ask me. I'm also going to invite a gynecologist to also help to talk on this. Number one thing is preeclampsia. Yes, this is the condition where a woman's blood pressure becomes so high. Okay, so when this woman's blood pressure becomes so high, at the end of the day, it can lead to AKI, acute kidney injury. And before you know it, when management is not done, it can lead to chronic kidney injury. You should not have kidney failure when you're pregnant, acute kidney injury just because you're pregnant. How can you prevent this preeclampsia from coming? Just take your antenatal very serious. They can detect that your blood pressure is high, and once they detect your blood pressure is high, they will start managing it. Okay, you can watch how to reduce your blood pressure on my videos that I made about blood pressure. Okay, they will start managing it. The most important thing is for them to find out on time. If they find out on time in the hospital, it is not a problem. They will manage it and know how you will deliver, if it is through CS or on time. That's number one. The second cause is hemorrhage. Yes, hemorrhage is bleeding. It can be before, during pregnancy, it can be after pregnancy. This one is not one of the complications of pregnancy. You don't know what to do about it, but what you will do about this particular thing is to get registered in a good hospital. Okay, if you get registered in a good hospital, if there is any complication at any time, you start bleeding, they can do something about it. If you're just in one of these local hospitals where the people that are there are not even trained, they are not even they don't know how to manage complications that may arise in pregnancy, what are you going to do when a woman starts bleeding and start bleeding? The people that are taking the delivery don't know what to do. This woman will go to AKI. If she survives kidney failure, most of the times the person can die. But if you are in a good hospital where they know what to do, either they refer you or they get blood, they do something immediately to avert this. So be intentional on which hospital you register your antenatal with, okay? Because of emergency, in emergency cases, especially when you want to deliver. So another one is this infection. Oh goodness, it can be malaria, it can be urinary tract infection. I've taught us how urinary tract infection can damage your kidneys. Okay, so if you're a woman and you're pregnant, please, when you have, when you're on antenatal, all these things will be found out. If you start noticing difficulty in urinating, many the signs of infection, just tell your healthcare provider, tell your midwife, tell your doctor. They will treat it. Malaria should be treated. Any form of infection, don't take chances. Okay, another very important one is low PCV. Yes, PCV means packed cell volume. Okay, women that their blood volume is low. If you're pregnant, you need to eat well, you need to take your pregnancy vitamins, you need to take your blood vitamins. Okay, it will help to improve your PCV. When your PCV is too low, the kidneys don't get enough of this blood and it can cause AKI. I'm also relating also to hemorrhaging. If you're hemorrhaging, I've talked about hemorrhaging, okay? The complication that arises when you're giving birth. Okay, so another one is this, um multiple pregnancy. Yes, if you're having a twin, if you're having triplets, your doctor has told you you're carrying a twin, be very careful. Okay, don't take chances. Always don't miss your antenatal. Always be hand in hand with your doctor, with your healthcare provider. Hospital should be close to you. Always pray, okay, so that everything will go well. Don't take any chances. These are just risks. It doesn't mean when you have multiple pregnancy you have acute kidney injury, but the complications are more, so you just have to be prayerful and do what you're supposed to do. Very important one is people that has given birth so much. The more you give birth, the chances that you will have complication arises. Now women no longer give birth to so many children. Okay, don't advise women to give, once you've given birth to 1, 2, 3, I don't know, four, but giving birth to so many children, it makes you, it the chances of complications arises, and it's so much. Okay, so please be careful. Take this information very serious and work with it. Make sure you like this video, share and comment.